Alright, so hello everyone and welcome back to today's webinar. So today I'm going to discuss a very fine case of mine, a case of bronchitis which I got a few days back, and it's a beautiful case. So let's start with the case. So let's start with the definition of bronchitis. What this bronchitis is actually is. So this bronchitis is actually the inflammation of the lining of your bronchial tubes which carry air from to and from your lungs, and people who have bronchitis often have cough up thickened mucus which can be discolored. Bronchitis may be either acute or chronic. So this was actually the bronchitis. And if you look around the x-ray of this bronchitis patient, there is different is that prebronchial coughing. You can see out here the prebronchial coughing. So what is this prebronchial coughing? Is referred as a prebronchial thickening or prebronchial wall thickening. There is thickening of the wall due to the accumulation of mucus. Is a radiological sign which occur when excess fluid or mucus built up in small airways of the lung causes localized patches of echicasis. That is the lung collapse. I hope this is visible to you all. And this was actually the prebronchial coughing that we know. So let's start with the case now. So this case is of 45-year-old male, a severe cough from last 5 days. And what was he doing at that time? He used to wake up suddenly. Due to the cough, and cough aggravated midnight, especially at 12 a.m. afterwards. The cough aggravate, and there is lot of difficulty in expiration rather than inspiration. Inspiration is quite easy, but expiration of air, it's quite difficult. And expiration air sounds noisy like snoring. So lots of snoring sound is there, but it was not snoring. Because of this condition, the bronchitis condition, is able to do that in a way which is not convenient to him. And when I examine the chest in this type of cases, you just have to take a stethoscope and you just have to examine the chest. There is lot of wheezing, especially from the right upper and lower lobe of the right side, and left lung, lower lobe. There lots of wheezing sound is coming. So in this type of case, particularly, what you have to majorly consider these 5 things you have to majorly consider. The chief complaint, you should just make one LHMC of location, sensation, modality, and concomitant. What is the location, where the pathology, what is the sensation, his sensation is actually in this pathology, and the modalities, when is it aggravated, when it is ameliorated, and the concomitant along with the major component, if there is any secondary illness. And then the observation, what you observe in the case, and the change state. What is that change state? How the state of the patient can change from the healthier state to the unhealthier state. That's the major thing. And is there any exciting factor which is aggravating the case particularly? If there is any exciting question, you just have to eliminate or make it in that, put it in the totality rather, or the generality. Is there any general thing which you can see in this particular case? So how I analyze this case, that's very simple case of mine, and how I analyze this case, and especially in this type of cases, as I told you earlier, as I used Fartak repertory law. And Fartak repertory, in this you can see cough, wake up midnight, after the midnight he used to wake up, and wheezing, whistling, whooping coughing, especially in whooping coughing, there sound like whoops. In that rubric I took. And expiration cough, that difficult, expiration of cough, that is difficult, and midnight after waking up, that is another rubric I took. In Fartak repertory, respiration, whistling, wheezing, wheezing I took. And Fartak respiration, loud, noisy, another rubric I took. You can take this screenshot as well. Respiration difficult, suffocating, choking, exhalation, that's all thing. If there is a lot of difficulty in breathing, especially in expiration, there is a lot of difficulty. That's why you used to wake up. So only single remedy which is coming out is Sembucus. Sembucus, a majorly integrated remedy, especially in the lungs pathology, is very useful, especially in the cases of asthma, COPD. Sembucus has got some miraculous results. So Sembucus 30 OD for 7 days was to stay, and then after SL200, and from this she did quite well. So this was the case. Hope you liked the case, and we hope you are getting the approach which I am using in this type. The approach is the main thing which you have to know and which you have to learn to evolve as a homeopath. So this was the book we have written along with Dr. Rajesh Mishra, Acute and Emergency Management, Homeopathic Therapeutic. It's getting very good response all over the India. So having to show reverence to all my teachers who taught me so much. And you can contact to me at nishant25smilebox@gmail.com, and don't forget to subscribe to our channel.